today we have Dr. Abu Egu, a renowned expert in infectious diseases from Yale's School of Medicine, joining us to discuss the 3-year anniversary of COVID-19. Welcome to the Black Report.
Thank you for having me. Very happy to be here.
If you don't mind, I'm going to call you Dr. O, because I have a tendency to lay people's names to rest. So is that okay, Dr. O?
You're in good company.
Thank you so much. All right. COVID-19, is it really over? I mean, people are still debating this COVID-19 emergency declaration billed to end in May 2023. Is this, what side of the argument are you on? Over, not over? Should we still be taking precautions? Your thoughts?
The COVID-19 pandemic for sure isn't over. I mean, we see that there's still too many cases occurring every day, roughly about 30,000 cases occurring in the US. And of those, about 2,700 get hospitalized, and we're still seeing death rates in the 300 range per day. And frankly, most of these estimates probably underrepresent the true scale of the pandemic. As you well know that, lots of people are doing home tests and lots of tests are not getting reported. And also, some of the data on deaths are not reported by certain jurisdictions in the US. So certainly the pandemic is not over regarding just community transmission. However, there's some good news and some silver lining, because we're seeing a dissociation between cases and bad outcomes, such as death, because we now have effective vaccines to protect against severe disease, even if people get infected. And we also have, better treatments. We've lost some along the way, but we have really defined what treatment works for that. And we even know how better to manage people when they're hospitalized, when to use oxygen, put people on ventilators, etc. So we're in a better space now than we've been historically, but there's still a lot more work to be done.
Dr. Abu Egu, beyond the disparities in COVID-19 numbers, how is COVID-19's impact on the Black community? How has it lingered? We hear stories in the news about long COVID and some of the other issues related to COVID-19. Talk to us specifically about Black folks. How has it lingered?
So that's a great question, right? And frankly, we don't have all the answers yet. And I think we're going to be learning about these for months to years to come, just, the whole impact of COVID. And looking at the impact of COVID, not just the direct effects from the disease itself, but like you mentioned, long-term sequelae from the disease, which includes long COVID symptoms. And for some people, those symptoms could persist and be devastating to the point where people are not able to return back to work, or at least their prior level of functioning. And so we've also seen that there are higher rates of mental health diagnosis in people who've recovered from COVID-19. And, part of it is all the uncertainty that happened during the COVID era, and just the fear and anxiety that induces into individuals who are vulnerable to the disease. We know it affected, people's income and employment. And, there have been some curious coincidences that have occurred, particularly among the Black community. We now see, for example, we knew that there were a lot more overdose deaths during the COVID-19 pandemic, and the recent trends are actually suggesting that Black men specifically, compared to their peers, are actually seeing much higher rates per population of opioid-related deaths. And we also know that there are probably other collateral harms that have occurred, because we know that during the COVID-19 pandemic, routine health services were either delayed or disrupted, including things that disproportionately impact Black communities, such as HIV, reproductive health, etc., and even cancer screening. So we're really going to unearth some of the significant injury that's occurred over time.
Yeah, and one of the concerning issues with COVID-19 and the pandemic is that the vaccine uptake, which that the vaccine has proven to be very effective, has been pretty poor for Black communities. What are some of the reasons, your thoughts on why, and then how can these reasons be addressed?
Yeah, so that's a concern, right? And something I've really been working very hard on over the past 3 years, right? Because I think it's a sad fact that the communities that are disproportionately impacted by the pandemic are the ones that actually struggle the most with receiving a quite highly effective and safe option to protect against COVID-19. And so the good news, though, is if you look at the trends from earlier on in the pandemic to currently, it seems there have been a little bit of catch up among Black communities because, we found that when we use the term vaccine hesitancy is kind of a broad term that ranges from people who want to just delay vaccination to ensure that, someone else gets it and safe, or more data has accrued so that their confidence in its safety was fine. Some had concerns about safety in pregnancy. You mentioned the issue with kids. If parents are hesitant, then you can imagine they're even more hesitant to even have their kids vaccinated. But the good news is that we saw an uptick in receipt of vaccines by the Black community, suggesting that our community is amenable to all the different strategies we did, trying to make vaccines available, trying to engage communities, to educate people about the vaccines, and really, trusted messengers like myself, being a researcher in the field, really, sending out that message and word to the community that these were rigorously assessed for safety and efficacy and they should be used. The sad part, though, is that we're seeing much more newer variants that are more transmissible and immune evasive, and the latest iteration of the vaccines, the boosters, still remain with very low uptake. Less than 20% of the individuals across races have received that, and that's very concerning.
Real quick, what lessons have we learned so far that will help to prevent the next public health emergency?
COVID-19 was a stress test. I think it really showed us huge deficiencies in the way we deliver healthcare, in the way we prepare for epidemics, and the way we respond to them when they do occur in almost every aspect of the response, from disease surveillance, to stay in touch with just the scale of the disease and new variants emerging, to making testing available, to making sure there's equitable access to treatments like you have mentioned, the same thing with vaccines. We failed. So I think that this is really an opportune moment and really has unearthed things that many of us have known existed all along. As an HIV provider, for example, these are things we've always seen, that communities of color are disproportionately impacted by some of these things due to just their vulnerabilities. So I think moving forward, I think even just generating the data on the disparities, I think really showcases the disparities to the world and calls for action. But we really need to deal with key issues like medical mistrust, medical messaging, equitable access to healthcare, treatments, institutionalized racism, and medical mistrust, all those things that are huge barriers to engaging the Black communities in what I consider to be life-saving interventions. And I hope moving forward that we address some of these.
Indeed. Dr. O, thank you so much for your time today and your insight. We appreciate your efforts and getting us and keeping us together. And we'll definitely have to have you back to talk more about this as we continue the fight against COVID-19. Thank you so much.
Yeah, thank you for having me and shining light on this important issue.
Absolutely.